To those affected by mitochondrial disorders, UMDF is here for you. Since 1996, we've worked to provide support, fund research, and create awareness.
Our mission is to promote research for cures and treatments of these diseases and to give support to affected families.
We want future generations to grow up in a world without mitochondrial disease.
I'm playing for the United Mitochondrial Disease Foundation.
Look at that. Nice check for you.
Over the years, our community has grown and our message has sparked a movement.
Hey everybody, it's Maya Mialnik. Have you ever heard of mitochondrial disease?
Together, we've been able to make a difference for patient families around the world. Today, we are helping thousands of people navigate their mitochondrial disease journey. We're here, listening and providing support. We're here, educating and connecting patients and healthcare providers. We're here, finding and funding the best cutting-edge research. We will not rest until we find a cure. Join the movement at umdf.org.
Hello, everyone. Thanks for joining us for our latest Ask the MitoDoc webcast. Can you believe it was nearly a year ago that we first brought you the Ask the MitoDoc webcast on the coronavirus? Well, here we are a year later and still with many questions from our patient families, and we hope to be able to get some answers for you tonight. I want to talk a little bit about our great panel of experts. From Akron Children's Hospital in Ohio is Dr. Bruce Cohen, and not far away from Dr. Cohen is Dr. Sumit Parikh from the Cleveland Clinic. Joining us from Children's National Hospital in Washington, D.C. is Dr. Andrea Groopman, and not too far from Dr. Groopman is our next doctor, Dr. Peter McGuire, who is at the National Institutes of Health. And joining from Children's Hospital of Colorado, Dr. Austin Larson, and from Palo Alto, California, Dr. Gregory Enns, who joins us from Lucile Packard Children's Hospital. Before we hear from our panel tonight, we have some housekeeping items for you. We've muted all of the lines, so if during this webcast you have a question, please use the Q&A button and type your question in so that we can get your answers. And we ask that you keep the questions focused on the topic of tonight's webcast. Also, please note information about the live transcription information, and you can see that information right on this slide. Our Ask the MitoDoc webcasts are made possible through the generosity of these sponsors, so we ask that you join us in thanking them for their continued support. 2021 is UMDF's silver anniversary. Throughout the year, we will have special memories that we'll be sharing with you on our website and also on our social media channels. So stay tuned, and we hope you share the information that you see on our social media channels. We also want to tell you about updates we've made to our coronavirus resource webpage, specifically about the upcoming distribution of vaccines and the impact on our patient community. Also, information from this webcast will be placed on this page. And make sure you check out MitoU. MitoU is a great resource for our patient families and for our scientific and medical community. It provides you with helpful information on the diagnosis and treatments, and we will continually update this with informational videos for your viewing, including the archives of the Ask the MitoDoc webcasts. As you might expect, and out of abundance of caution for our patient families, scientists, and clinicians, Mitochondrial Medicine 2021 will be virtual again this year. We will begin on June 24th and end on June 26th. And we invite you to check out the UMDF Symposium webpage for updates, for schedules, and for registration information. We also want to let you know about another one of the important programs UMDF has provided for the past 25 years, and that is patient support. We can connect you to one of our 90+ ambassadors around the country or through one of the hundreds of support meetings we hold throughout the year. So if you need support, please reach out and call us. Our number is 888-900-6486. With spring upon us, it's time to gear up for our Energy for Life walks. Walk your way this spring safely. Find a walk location near you and walk your way at energyforlifewalk.org. And looking ahead, next month, our topic for Ask the MitoDoc in March will be navigating patient care and billing. So mark your calendars for March 23rd at 7 p.m. Eastern And watch your email and social media for ways that you can register for this webinar and to submit questions in advance. Also, we wanted to tell you about something that's coming up this Saturday at noon Eastern. Dr. Francis Collins, the director of the National Institutes of Health, is going to have a webinar that's going to talk about vaccines and why it's critical that individuals living with chronic illnesses and conditions consider receiving the coronavirus vaccine. So you can go to this webinar on Saturday at noon simply by going to the UMDF coronavirus page, and there is information there that will enable you to click on a link to register. You must register in advance. They will try to get to questions. The webinar is going to be about a half an hour long, and we are promoting this in along with our friends at Genetic Alliance, who are actually hosting this webinar. So we hope that you will take some time on Saturday to go ahead and watch this webinar. So let's get started with this edition of Ask the Mito Doc and talk to some of our panelists this evening. And panelists, thank you all for your generosity of time tonight. We've had many questions surrounding the latest information on the coronavirus. And I want to start with one that I'm going to toss to all of you for your responses, and I'll call on you. Everybody wants to know about vaccines, mitigation, and about what's next. But everybody is most concerned about this one question. I'm a parent of a patient. I am a patient. Should I get the vaccine? And Dr. Cohen, I want to start with you on that. What's your answer to that obvious question that everyone's asking?
So I asked my nursing staff to put all those questions through to me, patient by patient by patient by patient, because I wanted to make a decision individually, as opposed to just a blanket yes answer. And the fact is that I've told every one of my patients with both primary mitochondrial disease, where we have a genetic answer, as well as those with outproven primary mitochondrial disease, those that I'm following with other disorders, to get the vaccine. And so far, most of my patients who've asked the question have gotten the vaccine and are doing fine. My own personal feeling, and there's not data to back this up, but my own personal feeling is that the messenger RNA vaccine, theoretically should be very safe in patients with mitochondrial disease. So that's my answer.
Okay, Dr. Groveman?
Yep.
Yeah, I would agree. I think the risks of having a severe course of COVID-19 would outweigh the potential side effects, mainly with the second dose of the Pfizer or Moderna. I don't know about the other vaccines because we haven't experienced them yet in the US, of getting the fever and the chills and the mild myalgias. So I would definitely, and I do tell my patients to get the vaccine. However, I do also recommend some observation after or during the second dose with hydration for certain patients, not every patient, but those who have had a history of decompensation. I do like to observe them more than the 15 or 30 minutes that's recommended.
Dr. McGuire, what's your take on this?
Yeah, so based on the answers so far, I agree with both of my colleagues in that, the risks that are associated with COVID-19, in patients with mitochondrial disease can be, quite devastating to their disease process. So we do believe that the efficacy of these it's been shown the efficacy of these vaccines is actually quite high, 95%. The safety profiles now these are in healthy individuals who do not have mitochondrial disease, are quite high as well. We don't have much data in mitochondrial disease per se. However, the data that is out there for vaccines in general say that for the most part, patients with mitochondrial disease tolerate vaccination reasonably well. And that's from a large study that was done, actually combining different types of inborn errors of metabolism from California, from the Kaiser system in California. So based on the safety that we've seen so far, the efficacy, and kind of what we know in general about vaccine in patients with inborn errors, it would be recommended, but I do echo the approach of approaching each person individually to look for a history of decompensation or a history of adverse reaction. But in lieu of that, it would be a good idea to seriously consider these vaccines.
So you mentioned California. Let's go to Dr. Enns.
Well, most of my patients are children. So as we know, the approved vaccines are for ages 16 and older. So unfortunately, no. But for my adult patients, in general, I say a general yes, but I also do what Dr. Cohen does is talk about each patient individually, because I want to make sure we take each patient's individual history into account as well. If there are certain things that seem to be working very well for an individual who has had a history of vaccine reactions, probably continuing to do the same sort of thing. But in general, I think I agree with what everybody's saying. Getting a coronavirus infection is going to be far worse than a vaccination. So protection is the most important thing, and taking each individual patient as an individual is important. So that's what I do.
Okay, Dr. Larson.
Yeah, I think I'll echo what my colleagues here have said. I also have had a few patients with mitochondrial disease who have had the vaccine and done well. I guess can maybe touch on a few topics that I've been asked about by my patients. So, you know, I have heard several times about the accelerated time frame and concern about how quickly the vaccine has been developed. And that's true, and it's remarkable, and it's a huge accomplishment. I would also say that we have now given over 50 million doses in the United States, and at least speaking for myself, I've been diligently responding to the reminders to document my side effects, and so I've done that, and I think a lot of other folks have as well. The way that we rolled it out in healthcare providers initially, I think, allowed for a really kind of health literate population to be the initial broad administration of the vaccine, and I think that's been quite reassuring from what we've seen. So I'll just make that point in addition to what other folks have said.
Okay, we'll wrap this up. This question up with Dr. Parikh.
Well, last but not least, I think the gist of it is most patients will probably benefit from the vaccine. Individualizing it is probably one of the most important things, and talking to your mitochondrial care provider is going to be essential. Like Dr. Groopman mentioned, some people may need some individualization. Most people don't. Most people that we've given the okay to have been just able to go and get the vaccine and haven't needed to do much else besides maybe some extra ibuprofen or acetaminophen, and they've done well. We've had some high-risk pediatric patients who are on the list to get the vaccine who have not received it yet, and we'll see how they do. And I know, Cliff, this was already advertised, but I should, just in case those in the audience don't know, the Mitochondrial Medicine Society, working with some of the people on this call, as well as with international metabolic groups, have put out a statement on the Mitochondrial Medicine Society website that has a bit of an FAQ that goes through who should and who should not receive the vaccine, and maybe answer some questions. And then the United Mitochondrial Disease Foundation, through their scientific advisory board, has also put out a statement that, again, some of the people on this call have participated in, and that's been posted and up. And we'll update both of those statements if we get new data and information. But for now, what you're hearing on this call is what the general recommendation is when you read all of that information.
Yeah, I'm glad you mentioned that, because there is a link to that on the UMDF website under the coronavirus page. So if you have time, check that out. And Dr. Parikh, I want to stay with you for a minute. I've heard the word individualization several times. Explain that to me. What does that mean?
Sure. So, you know, everybody with mitochondrial disease may respond very differently. we could have a MELAS patient who does perfectly well with colds and fevers and flus, and then we've got somebody who just gets a little bit of the sniffles and needs to come in because they're having a lot of worsening symptoms and needs to get admitted for treatment. And so that's where individualization comes in. So most of us hopefully know our patients well and the type of tolerance they have to having their bodies stressed medically. And so there are people, like Dr. Groopman mentioned, that may either need to come in a little bit ahead of time or stay a little bit more for observation or receive IV fluids. There may be people, I think on a rare occasion, where we may need to observe them overnight after vaccination. There may be a rare patient who has associated reactions to vaccine where it's attacked their nerves, and we might say you might not receive this, or we really need to monitor you closely in clinic if you get it. And then there are the people who just wilt when they get fevers that we may say, okay, once you get your vaccine, maybe add a regimen of Tylenol, Advil, Motrin, at least for 24 hours until we see how you do.
So let's talk a little bit about the vaccine. In doing a little bit of research on this, these are messenger RNA type vaccines. So is this a new type of vaccine? Dr. McGuire, I want to ask this question to you so that we can all understand. Tell us how these mRNA vaccines actually work. And one of the questions we had, which was interesting, is if you take this vaccine, does it alter your DNA?
So that's a great question. One thing I just wanted to echo with some of the stuff that Dr. Larson had said before, just with regards to the development of this vaccine and people concerned about whether it's too fast or not. They should know that people have been working on coronaviruses and a coronavirus vaccine for over 10 years. And this is related to previous coronavirus outbreaks. So back in 2002, there was another SARS outbreak, essentially, where there was development, essentially, of a vaccine during that time. In 2012, there was also MERS, which is another coronavirus. So there's a lot of history there. And the reason that this was able to move so quickly is because we already knew quite a great deal about the coronaviruses themselves, about the spike protein, about how they enter cells. So that process was known actually for quite some time, and there were already vaccines in development for the previous iterations. So that combined with things like supercomputing, the worldwide effort, large amounts of money being poured into it, really helped speed up the process for what we now have which are mRNA vaccines, right? So these mRNA vaccines are essentially, mRNA stands for messenger RNA. So this is a blueprint which is delivered to cells. So the cells, essentially like muscle cells in your arm. And that mRNA as a blueprint then makes the spike protein of the virus. So it doesn't make the complete virus. It only makes a small portion of it, which is then presented to the immune system, which recognizes it and mounts an immune response. So the idea behind this, like any vaccination, is that by mounting an immune response, then the next time you see it, you will mount actually an even more robust immune response. So after you've received your 2 doses, you may essentially not experience the disease at all, or a very attenuated version of the disease. Now, the cool part about the virus is, I don't know, people may remember from many years ago when I was growing up as a kid, there was a show called Mission Impossible. And Mission Impossible began every episode with a message, and that message self-destructed. The same thing is true with this particular vaccine, in that there is a message in the messenger RNA, or a piece of the messenger RNA, that actually causes it to self-destruct. Now, the concern is that, well, does this get converted into DNA? And so it does not. So that actually does not happen in human cells. So by virtue of the fact that it self-destructs relatively quickly after delivering its blueprint and making its spike protein, so therefore it's a very quick process which doesn't turn into DNA and is actually quite safe for individuals.
Dr. Parikh, is there anything that a patient should consider before going and actually having the jab?
I'm going to come back to that question. I want to add one more thing about the mRNA vaccine issue. The more we've all learned about this, and most of us, I think on this call, I shouldn't say most, some of us on this call are more clinician and less scientist. mRNA vaccines were not necessarily kind of in our knowledge base to the deeper level they are now. It turns out this is research that's been going on for a couple decades. And the more you learn, you realize that kind of our scientific system and approach failed these mRNA researchers and the mRNA vaccine researchers. This is something that could have potentially been developed a lot sooner, like a decade ago, if the powers that be that fund all this research had the interest of wanting to make this happen. And it took something like this pandemic for all this to come to light. I think if you just Google mRNA vaccine pioneer, I believe it's like the second article that comes up. That's very interesting to read in case any of you are interested. And then it just kind of goes through what it took this person, the drive it took this person, despite being told by everybody at their academic position that this is not something that was going to succeed. And they believed in the science and technology so much that they continued doing this research for 20 years and then move the ball forward to something that, we're going to really make a huge impact with this vaccine to get the world functional again. And in some ways, it is definitely a lesson on how people need to maybe rethink how we're funding research. Spinning back to what do people need to be thoughtful about before getting the shot? So I think we always want our mitochondrial patients, when they get medically stressed, whether it's surgery and fasting, or whether it's other immunizations, and then even the COVID vaccine, we want to make sure they are in a good state of health, that they are in a solid place metabolically, that they are eating and drinking well, they are not sick themselves, and able to go in and get this without their body being taxed in any other way. So if they have something coming up as far as a medical procedure, that's not the right time to do this. If they are sick themselves, they should wait and reschedule that date.
So we have a couple of vaccines out now, with more coming online soon, including one that just requires one shot instead of two. So Dr. Enns, patients are asking, is it better to get the vaccines with 2 shots, or should I wait for the vaccine with the 1 shot? So they would like to know, is there any recommendations on that?
Well, I don't know is the simple answer from me. I've seen the data related to the mRNA vaccines, and they look very promising and very solid. I would have to see further data on any of the other vaccines that are coming out, and honestly, I don't have a good perspective on them. I think in general, if there's a vaccine that's available, and it's been vetted and approved by FDA, I think in that sense, it's probably safe to go ahead and use, but this is also a conversation that individuals should be having with their own physicians as well. I look forward to reviewing the data as it comes out though, and I'm excited that there are going to be other vaccines out there. So I think for me, it's a little bit of a wait and see, but I haven't seen enough information to really make a determined evaluation, and I can't make a clear recommendation yet.
Dr. Groopman, would you consider there to be a downside if you're a patient in waiting for a vaccine?
So, I mean, I was just going to echo what Greg said, is if you have the opportunity to get the vaccine and your mito physician feels that you are a candidate for it, even if that requires some special pre and post observation, I would get it, because one of the possibilities is that if you wait, you may not get any vaccine. So I would not worry about the possibility of what if, because we don't know. And I would take the vaccine that you're able to get, if with appropriate precautions, if that needs to be done given your individual situation.
So Dr. Larson, we have a question from a patient in Portugal, and like many patients, she gets side effects from vaccines. So what is the recommendation for a patient like her that has had previous vaccinations and gets side effects?
Well, with any medical intervention, there's a risk-benefit ratio to think about. To the point of your earlier question to Dr. Enns, the question about the different vaccines that are available, I think it's important to look beyond the headline number that has been published, the 95% effective or 66% effective. That, for the most part, when you see a headline like that, that is the protection against any disease at all. But I think it's important to know that the protection against severe disease is a much higher number. So even that, the vaccine that's, say, 66% effective is much, much more effective against severe disease. So the rate of death, the rate of hospitalization in the trials was extraordinarily low for all of the published trials that have gotten as far as even being considered at this point for approval. So the question of what are the risks and what are the benefits? So the benefits to you as someone considering getting the vaccine, the benefits will be greater the older you are. The benefits will be greater the more medical comorbidities you have, in terms of those comorbidities that have been demonstrated to be dangerous in the setting of COVID infection. The risks that we're talking about have been proven, or at least in the trials and the initial surveillance, have appeared to be relatively minor in comparison to that protection that we're talking about. And the risks that we're talking about are kind of mainly two things. So one is allergic reactions, and that has happened in a small percentage of individuals who've gotten the vaccine. And the other is the kind of symptomatic inflammatory response, the fever, chills, muscle aches that people get. And so, of those two, the inflammatory response is much, much more likely. And in particular, for people that don't have a history of allergic reactions, that's by far the more likely of the two. And that appears to respond fairly well to symptomatic treatment. And that side effect doesn't appear to be dangerous for the vast majority of patients. It's unpleasant, but probably not dangerous. And again, to Dr. Parikh's point and Dr. Cohen's point earlier, we do have a few patients that we really, we treat fevers aggressively. Any kind of inflammatory state we would manage aggressively with supportive care. And so in that scenario, it would be important to discuss with your physician how they would want you to approach the vaccine.
And Dr. Parikh, I want to come back to you for this next question, because it's an interesting question. If a patient has a food allergy, are you hearing any concerns for patients with those types of allergies and getting the vaccine? And I know it's on the MMS document as well, but we've had a number of questions about that.
So I'll defer to somebody with more expertise about any specific ingredients in the vaccine, but as a whole, allergies in the past to routine vaccinations or to certain foods, dyes, chemicals, there has not necessarily been an issue with this specific vaccine. There's no mercury added to this vaccine. The allergic reaction that Dr. Larson spoke of is something that has been treatable for many people with just an antihistamine, and on a very rare occasion, something like an EpiPen. So the majority of people are usually having mild allergic reactions, even if they are.
I can follow up on that because my daughter has severe food allergies, and we did discuss it with her allergist because she volunteers in a hospital, so she was eligible to get the vaccine. So no, most people with food allergies, even anaphylaxis, do quite well because none of the ingredients, at least in the Pfizer vaccine, cross-react with any of the food allergens. However, it was advised that she bring her EpiPen with her to the vaccine site, and just in case, but there were no problems.
We've heard a lot in the news about people are being vaccinated in order of medical necessity. I know UMDF sent a letter to each state asking that mitochondrial disease patients be given priority in getting the vaccines. And we've heard from a number of state health departments saying that they would be given priority. But one of the conditions is obesity. But let's flip that. We have a patient who's a caregiver who's caring for a patient who is considerably underweight. Is that a concern in getting this patient that vaccine? And Dr. Cohen, I'd like to ask that question of you.
So, I mean, I think that's a great question. It goes back to some of the comments my colleagues have made, is that one may want to take some preemptive precautions in not necessarily treating anything before it happens, but in someone who's underweight or malnourished, or has a propensity to become quickly dehydrated, to act as you would in any other situation when that person became ill, and that's to get them to the clinic and give them IV fluids if that's what's necessary. But no precautions for patients that are underweight. I have a couple of MELAS patients that have gotten vaccinated. They are underweight. Their nourishment status is not great. They've got diabetes, and they have done very well with the vaccination.
Okay, Dr. Grobman, I'm coming back to you on this one because we've talked about allergies and such. And what if you're the caregiver of a nonverbal patient? They get the vaccine, and obviously you're concerned about any kind of side effects. What should you be looking for in a patient as far as a reaction for a patient that is nonverbal?
I think, any type of reactions we look for in our nonverbal patients. So there'll be the medical issue. So if the child has a fever or appears to, look ill or not feeling well, but oftentimes a change in behavior may signal that something's not right with that child. And most parents or caregivers are pretty in tune with their child's cues, even though they're nonverbal, because I'm sure in the past the child has not felt well and the parent was able to tell. Either they'll describe a look in the child's eyes, looks glassed over, lethargic, the child just doesn't respond in the normal way. There may be a significant change in behavior, more grumpy or more quiet or more excitable than usual. So I think parents are pretty good at picking out what is atypical behavior for their child.
Dr. Enns, I know you see a lot of pediatric patients, so I'm going to ask you this question. How long do you think it will be before there is a vaccine for kids 16 and under?
Right, so they're doing clinical trials, last I heard, with children who are 12 and up. So, the way they performed these last trials for adults was quite rapid. So I'm always optimistic and glass half full. So I hope relatively soon, but I don't know exactly what that means. And I'm optimistic that we'll have something for children in the not too distant future, but whether it's months or next year, I don't really know. But this is something that is commonly done when we start with a new type of a therapy. It often is used initially in older patients and adults, sometimes teenagers and adults, as what's been done here, and then slowly moves down into younger age groups as safety is proven. In any vaccine development and any therapy development, safety is always the most important thing. And I think that we're all waiting anxiously to see what the results of these studies are going to be. But again, I wish I had a better answer as far as how soon. I don't know, not soon enough, but I hope things will go quickly as they have done already for the adult trials.
Dr. McGuire, I'm coming to you next. We have a question from the LHON community. And the patient wants to know if they are eligible to participate in the mini study and what information you would be looking for them to share about their experience with COVID. And I'd like you to talk a little bit about the study if you could. And also, are you hearing from any patients that are having adverse reactions?
Yeah, thanks for the question. So the mini study, first of all, just very quickly, is a study that's been going on now for about 6 years or so. And this is a study that looks at viral infections and immunity in individuals with mitochondrial disease. So in that study, we actually primarily recruit children to our study because we're essentially pediatric trained and a pediatric neurologist on staff. So within that study, basically, we look at various aspects of the individual's history of viral infections, whether they've had any kind of adverse events with viral infections, and then what type of disability they may have developed or had exacerbated as a result of having those infections. And then we also evaluate their immune system and how their immune system functions and whether they're protected by their vaccines, et cetera. With regards to, so the adverse events that you're referring to, are you referring to ones with vaccination, or are you referring to COVID?
Correct.
Or
Correct.
Yeah.
If anybody's had any, yeah.
So we have not, to this point, actually heard of any individuals who have had any adverse events with regards to vaccination. But once again, it's kind of it's a bit of an opt-in system, right? Where people will, are usually contact us, but at least the cohort that we follow, no, we have not heard of any adverse events to date.
Okay. So Dr. Larson, if somebody has had the coronavirus, are they still able to spread it to somebody who hasn't had it yet?
Well, that's a fairly technical question. Dr. McGuire, would you be willing to tackle that?
Yeah, so the data at this point is that we don't know.
Okay.
But the reason that this question came up is because it's being talked about right now, right? Because the recommendation is even after receiving your full course of vaccination, you should still practice, your social distancing behaviors, your hand washing, your, masking, et cetera. And really to address this unknown that you may actually be able to actually catch the virus, not be symptomatic, and actually pass it. So that's probably the basis of the question. And at this point, as I said, we really don't know. So those recommendations that's why they're in place.
Dr. Cohen, what happens if a patient goes and gets their first shot? And then, as you know, patients who have mitochondrial disease, it's unpredictable. They're just not feeling well for the second shot, or something's happened. And maybe by that time, when they're ready to schedule the second shot, it's not available. What should they do? I guess the question is, what if I get the first shot and I'm unable to get the second shot?
So if you're not able to get the second shot because it's unavailable, this is not a problem that I have seen happen in my county.
Okay.
So I think, all politics is local. And the state of Ohio has been really good about when they say they're going to deliver 970 doses. That's what shows up on the doorstep the day before, or the day we expected, the day before we're given vaccines. So I think the advice would be get the shot when you can, get that second shot from the same manufacturer when you can get it.
Well, this is a stupid question, but I'm going to ask it anyway. How do you know which shot you're getting? I mean, do they tell you that?
They tell you. You'll get a card. Everyone in the United States has the same paper card that if I don't have it on me right now, but I could show it if I did. And it has the Moderna or Pfizer name handwritten on it. Some places put the lot number, other places do not. And it's dated. And it's about as unofficial looking a card as you could imagine, except it does have a government seal.
And so that helps track which vaccine you've received so that you get the same
That's right.
Okay.
And we recommend that you take a picture of it, store that picture on your cell phone, because if you don't have the card with you, you can always show it. It's about as good as the identification that we have right now, stating that you've had the vaccine. I don't know, Dr. McGuire may be able to answer if the federal government is planning anything more official looking than that card.
No, not as far as I know. And actually the card I just flashed, which was my own, yeah, you're absolutely right. It looks not quite homemade, but it doesn't look as official as you would expect. But what I can say, following up on your comments from before, is the talk now is at the end of February into March and going into the spring. It's the amount of vaccines that are actually going to be distributed is ramping up significantly. So it's actually going to become a situation where, like Dr. Cohen was saying, that it's not going to be an issue of not being able to get your second dose. There's actually going to be a flood of doses, essentially, where which will be a very different situation than what we're experiencing right now.
Okay. Dr. Parikh, let's suppose a patient gets the vaccine and then has side effects. The patient wants to know, is it okay after the vaccine to take an ibuprofen or acetaminophen?
Yeah, so again, this should be individualized. There are select patients who might have ongoing liver issues where acetaminophen may be used with caution or not at all. They may have ongoing kidney issues or GI issues where ibuprofen may not be tolerated. But outside of that, and after conferring with your medical team, absolutely. I think that second shot, for those of us who've had the Moderna second shot, it was a tough day and a half and lots of aches and pains and chills and fevers. And so, yeah, I think without Advil, Motrin, Tylenol, it would be hard to kind of get through. So I would say absolutely.
So I'm going to ask Dr. McGuire this question, and all of you, please chime in if you feel you have a response. But is anyone looking into the actual impact the virus has had on our mitochondria from a research perspective?
Yeah, so there are a number of groups that are actually looking specifically at mitochondrial disease. I know, for instance, we're collaborating with Doug Wallace at Children's Hospital of Pennsylvania, Philadelphia, excuse me, who is looking at essentially some of the viral products of the SARS-CoV-2 virus and how it may interfere with various aspects of mitochondrial function. We at the mini study are, following cases of individuals who have had COVID-19 to just document essentially from a distance what their outcomes have been. And then also we're trying to learn a little bit more about viral exposure in the mitochondrial disease community by sending out kits that people can do in their home where they actually take a blood sample from their finger and send it back to us, and we can learn about their viral exposures and their family exposures during this pandemic. Because as it turns out, a good proportion of caregivers, especially for children with mitochondrial disease, are actually essential workers. On one survey we did, I think it was like 20 to 30% were essential workers. So therefore, the home then becomes kind of a potential site for infection for children, essentially. So that was one of the reasons that we're doing this study. So there are at least a few studies going on. The international community as well is also trying to capture COVID-19 cases through databases. So there is a good amount of work going on, but mechanistically, I would say Doug Wallace is probably the person that I know of at least who's working on how the virus itself specifically interacts with mitochondria. Because mitochondria are actually a very important part of the antiviral response in the immune system.
There's also the Rare Disease Clinical Research Network is looking at all rare disorders. And since NAMDAC is one of the rare disease consortium, by virtue of being part of that, whoever filled out the questionnaires, their data is being analyzed as part of how does having COVID-19 affect somebody with a rare disease? Did people get it from their family members? How do they think they got the virus? How long were they affected? So, and there'll be a follow-up to that. So many of the participants indicated that they would give permission to be recontacted. So there is that. That doesn't give the mechanistic. It's more of the how many people got it and what was their outcome and under what circumstances do they think they were exposed.
And I think the good news is we're talking about vaccines tonight. A year ago, we were talking about staying put, masking, washing hands. So that is positive. And I'm sure you would all recommend that those protocols still be followed. So let's switch gears now and take some of the questions that have been coming in on the Q&A. And just so everybody knows, if we can't get to your question, we will get an answer for you and make sure you do get an answer to your question. But one of the questions we have, and it's kind of an interesting question, most of our patients are on a Mito cocktail and taking supplements. And Dr. Cohen, I'm going to ask you this, and Dr. Parikh or whoever would like to chime in. Should they stop taking those before they do the vaccine or continue that? I mean, what would the protocol be?
My protocol is to continue everything that you've been doing. So no change in supplements, no change in medications. Just come in, get your vaccine as if it was any other day.
Okay. I guess everybody weighs in on that. Perfect. Okay.
Sorry, yeah, I just wanted to mention one thing because it's come up several times about the ibuprofen and Tylenol.
Yes.
Someone actually wrote in the questions that had come in, I think, about the CDC actually had recommended against Tylenol and ibuprofen with regards to pre-medication for receiving the COVID-19 vaccine, especially around the second shot where you tend to get those symptoms.
Yeah.
Now, just to let everybody know that that I agree with Dr. Cohen, you should continue to do, if that's what you were going to do normally, you should continue to do that. Those recommendations are essentially based on 2 studies. One study is actually in mice. It turns out that NSAIDs like Tylenol and ibuprofen tend to decrease something called eicosanoids, which are important kind of mediators of the immune response. And they found in the mice, then they make less antibodies against whatever they are being vaccinated against. Statistically less does not mean not protected. So it's a mathematical finding in that it was less. The second study is a study in children, which was done a number of years ago, once again, looking at vaccination and providing preemptive, essentially, NSAIDs. And once again, they showed that the levels of antibodies against the particular vaccination were lower, statistically lower, but it was not medically significant, meaning that they actually offered protection. So therefore, people should continue with whatever regimen they've already discussed with their providers, basically.
Interesting question that's coming in. You've all no doubt heard about the variants to the coronavirus that we're seeing across the globe. Are you anticipating a need for an annual coronavirus vaccine based on our traditional flu vaccines? And I'll let whoever.
We're all looking to Dr. McGuire.
I know, I was looking to him as well.
Sorry, so, okay, so it was interesting. I was actually watching, one of the people I follow is Paul Offit, actually, who's at University of Pennsylvania Children's Hospital, Philadelphia, who's a vaccinologist, who's a fantastic resource. And they have a center there on vaccines and information regarding vaccines. And he said, basically, with regards to the variants, he goes, when I will start worrying? I will start worrying when I hear that essentially being vaccinated with the new variants doesn't protect you against the severe manifestations of the disease. He goes, but until that time comes, I am very hopeful in that, cases are going down right now. Hospital admissions are going down. ICU admissions are going down. And part of this has to do with people's adherence to social distancing measures, hand washing, masks. A good proportion of the population actually also has already had COVID-19, so that offers some aspects of immunity as well. And then, of course, vaccinations that are rolling out now. So, basically, with the variants or anything having to do with this pandemic, and I take his word for it. He says, the only time I will start worrying is when I start seeing that benchmark where these new variants are actually causing severe disease in people who were vaccinated against COVID-19.
Dr. Cohen, I want to ask you this a question coming in. The second Pfizer vaccine, or any of you that can answer this, does it have the same reactions as the Moderna vaccine? Are you hearing anything like that?
So I have had some patients that have had the Pfizer vaccine, and some of them have had that same side effect. The studies showed that the Moderna vaccine had more side effects. I just don't see any, in my patients, any significant difference. I agree with Dr. Parikh's, description of it. It feels like you've got aches and chills and headache and just want to crawl into bed and go to sleep. And that's what I recommend to my patients: crawl in bed and go to sleep. It'll last, 24 to 36 hours in general.
Dr. Grobman, I want to ask you this question. A lot of patients are concerned that they can't get appointments because they don't have a mito doc. What's the best way to go about? And I know this is variable state to state, but what's the best way for a patient to go about getting an appointment to get at least one shot and then follow up with a second?
Yeah, so I mean, again, this is going to vary where the patient lives and what their access is to specialized care. I think, if they don't have a mito doc, they certainly should have a primary doc, and that primary doc should be in contact with whatever specialists are available to them. It's different. I mean, every state has different rules in terms of what tier you're in for vaccination. I know I work across DC, Maryland, and Virginia. It's different. Every state or jurisdiction is completely different in terms of who is considered tier 1A, B, C. Our hospital is starting to put together a list of priority diagnoses. So I think it's really going to depend on which state someone lives in, where they are in the priority list, but definitely working with a provider. I mean, they can certainly tell their primary care provider about this symposium that we're doing right now and what information they learned from this, but it's really hard to do it on a case-by-case basis, not knowing what type of specialists or medical facilities are proximal to the patient. Can I back up on the Pfizer?
Sure.
So I got the Pfizer.
Okay.
That's the only one that's available. And I actually did pre-medicate because I have a problem with vaccines, with flu vaccine even. I get pretty sick. And so I took a Tylenol like about an hour before. And I also have some allergies, so I took an extra allergy medicine. And I still got symptoms. I got probably an attenuated reaction to what you all described. I did get some chills. I didn't get a fever, and I got some aches and body aches that lasted about 24 hours. And I got some swollen lymph nodes as well. I don't know if that is seen with the Moderna, but some patients who have received the Pfizer vaccine at my facility have also complained of swollen glands, basically under their arm on the same side where they got the vaccine. I got that and it lasted for about 36 hours. So even though I pre-medicated, I'm pretty sure I got a pretty vigorous immune response. So.
Well, I want to go to a question that we got, and I'm sure we all know somebody that's had COVID, family members, and I know one of my family members, well, my mom, who is elderly, and it's an interesting question because she was told that she couldn't get the vaccine for 90 days post-COVID. So the question is, if you've already had COVID, the coronavirus, should you still get the vaccine? Dr. Larson, Dr. McGuire, you're shaking your head yes. Go ahead.
Yeah, so yes. So part of the reason is because how the SARS-CoV virus works is it has certain kind of tricks it can use to actually evade the immune system, right? So you probably heard during this whole pandemic of some studies that have been done that, sometimes the antibodies don't seem to last that long. And therefore maybe immunity would actually not be as robust as a result of having the SARS-CoV-2 virus. So in that case, for instance, then giving the vaccine in a situation where it's not an infection, right? So you're priming the immune system, but yet you don't have all these tricks that the SARS-CoV-2 virus can use to subvert the immune response. So you're getting kind of a more pure immune response, basically, from using the vaccine. So therefore, so the idea is then to, kind of give a boost. So it's not to say that you won't have any immune response against the virus itself. You will, but it probably will not be as robust and as protective as the vaccine itself, because of these kind of subversive mechanisms that the virus actually has to get around immunity. So it is recommended to have the vaccination.
I'm going to stay with you on this question too, because of storage issues and administering the vaccine. What is the protocol for having these shots at these mass inoculation sites, I'll call them, vaccinating hundreds of people at a time? Will doctors be able to adequately observe a patient in these major areas of vaccinations to see if they're suffering side effects? And what's your take on that?
So, I mean, I guess it depends. This is all going on the state level in terms of how this is being rolled out, right? So there's talk that vaccines are also now going to not only have these large vaccination sites. I mean, I'm from New York City originally, and they were using the Javits Center as one of their, as one of their sites essentially. But I can't tell you what the protocols are there, but I can tell you what the protocols that I've experienced essentially is that the observation for adverse events after the vaccination is essentially 15 minutes, right? So individuals who go to these sites, at least the site that I went to, the observation period was about 15 minutes. And that's probably relatively the same across these other sites as well. There's talk now of, much like the influenza vaccine, also distributing this amongst pharmacies like CVS and whatever your local pharmacies are as well, to try and get more vaccines into the arms. And at least locally, our pharmacies for other things like influenza and stuff like that do have a bit of an observation period after the vaccine. So while I can't make any blanket statements because it really does depend on the state, most of them probably would have some type of observation period. Yeah.
So Dr. Enns, we're not vaccinating kids right now, but what are you telling the parents of children affected with mitochondrial disease? What are you telling them about vaccinations?
Well, just what we've already discussed a little bit, that there are trials that are being performed in children, and we hope that we will be vaccinating children in the future. The parents are particularly interested in whether they are being considered to be healthcare providers because they're taking care of fragile patients who have multiple issues. And unfortunately, I can't really make that determination. There's been a lot of talk already, I think rightly so, that it varies from state to state. In California, it varies from county to county, and how each county is interpreting the guidelines and how the vaccines are being rolled out is a little bit different from one place to another. So we're being vigilant. We have a sort of a Q&A answer session going on at our local hospital as well, and sort of the facts for people to follow. But mostly we're saying that the care providers should get vaccinated as soon as they can. So mostly the parents, of course. And for children, it's going to be an individual-based decision once that the vaccines have been approved for younger individuals. And we look forward to that time.
I know we're running out of time, but I do have a couple more questions I want to get to if you can all hang with me for a few more minutes. Dr. Larson, one of the questions we've gotten tonight is that the parent read that, or the patient read that the vaccine is lipid-based. Does this matter to those with fat or protein metabolism changes?
Yeah, so I care for patients with fatty acid oxidation disorders, in addition to those patients with other mitochondrial disorders. I would say that the fat intake from the vaccine is many, many orders of magnitude smaller than the dietary intake that we might be restricting for those patients with severe fatty acid oxidation disorders. So I would not worry about that.
Okay. lot of general questions. One question that we have is that a parent, both husband and wife had COVID in November. They have a nonverbal child under the age of 18 that did not get COVID, nor was the child asymptomatic. So the parent is asking, is there any value in getting an antibody test for their child with mitochondrial disease? Not so much because of a vaccine question, but because of long hauler symptoms look so much like the conditions that the daughter already has. And that's the question that they're asking. And Dr. Cohen, I'll ask if you can answer that one.
Yeah, what I've been told is that the antibody test is neither specific or sensitive enough to know for sure one way or the other. But again, the real expert about the antibody test would probably be Dr. McGuire and can give us an update.
Sure.
Yeah, all I can say to that, Dr. Cohen, is it varies by center, basically. So yeah, there are, it depends on how good your test is. So in some cases it may be informative, in some cases it may not be.
Okay. Can you talk a little bit about patients that have mitochondrial disease and are immune compromised? And what do you recommend to see if they have built up the immunization against COVID? So Dr. Parikh, I'll ask that of you. What are you looking for to see if they've built up the immunization?
And I will
Unless you want to defer it.
Yeah. Most of the mitochondrial patients, don't have a standard immunodeficiency. So most of us are not as familiar with managing those kinds of issues. So if somebody really has a specific immunodeficiency, we would definitely be having an immunologist weigh in on what needs to be done.
Dr. Grotman, a question came in. They want to know if white blood cell count is low, should you still have the vaccine?
I'm going to defer to Dr. McGuire.
Okay, Dr. McGuire.
Once again, how low is low? That's something that should be done in consultation. If there's concern about immune issues, that should be done in consultation with an immunologist, basically.
Okay. I'm going to wrap up with this question. And understand if we didn't get your question tonight, we will get answers to your questions. Only because I think it's a great way to wrap this up. And I will ask you each for a response. So what do you think this is all going to look like when we're all vaccinated with regard to navigating, going out in public? Are we going to get our lives back to normal? Are we going to still have to wear masks, staying away from large crowds? What do you all think is going to happen? Dr. McGuire, I'll start with you.
Yeah, so this is where the crystal ball comes out. No one can really answer that question. Certainly, as vaccination becomes more widespread and we, start to get towards what approaches herd immunity without any variants kind of taking over and being kind of able to, evade the immunity that's out there, we're still going to be doing a lot of social distancing measures actually for quite some time, and masking as well for quite some time. Whatever I would say would be hazarding a guess. I think now we are in a very positive place where we're going in a very positive direction. But I think even the smartest epidemiologist or public health person wouldn't hazard a guess. They would just take the wins that we have so far and understand that there will be at least more of some of the protective measures that we're currently doing.
Dr. Enns, do you have any thoughts on that? Or your hopes and dreams for the future?
Well, I have lots of hopes and dreams, but I'm not sure my crystal ball is any clearer than anybody else's. One of the things I think that is here to stay is actually telehealth. And in dealing with the pandemic and our patients, and I think a hybrid system, as at least of visiting the doctor and having the doctors and care providers being able to take care of people who might be driving huge distances, will actually be a benefit and good. I think we're probably going to be seeing more people with masks and other distancing sort of procedures that are becoming more natural during the winter months anyway. Maybe that'll help with our general influenza sort of outbreaks and things that we sort of take for granted. However, I don't really know what the future is going to hold, but it's going to be better than what we've seen so far.
Dr. Larson?
Yeah, so to pick up on one of Dr. Enz's points, we just got an email yesterday from the chief medical officer of the hospital here that I work at a children's hospital, but there have been 0 cases of influenza at our children's hospital this year, which is just unthinkable, right? Like we've made it through most of a winter with 0 cases of influenza.
Why do you think that is?
Well, it's because of the measures that we are taking. So, you know, we've changed the social norms around how we behave when we're sick. Do you go to work when you're sick? Do you go to school when you're sick? People haven't done that this year, and it makes a big difference. It makes a big difference to wear a mask. It makes a big difference to, you know, be really attentive to hand hygiene. So just to tell you an anecdote, I saw a patient today who's in her late teen years, and she has significant neurologic involvement with her mitochondrial disease. She has never been able to go to school between November and April because of the respiratory viruses. Every year she gets respiratory viruses. And this year she's been in school the whole time. So this is the one year that she's been able to stay in school. So I think, you know, obviously we're doing things right now that are unsustainable, and we would not want to sustain some of the things that we're doing, but other things are relatively low impact. And I think it's important to think about what have we learned this year that actually may make things better for patients with mitochondrial disease for the long term.
So Dr. Groopman, I'll come to you next. I hope we don't have to have this similar webinar a year from now. What are your thoughts?
Well, I mean, I think life won't be back to normal as we know it, at least not in the short term. I mean, even if we reach herd immunity and people are immunized, and there'll still be mitigation procedures. It's always a good idea to practice hand hygiene, for example. I mean, that's not going to go out of style, nor should it. Probably some degree of masking, avoiding super large crowds for some time until we actually know the staying power of the vaccines and the virus itself in terms of the other variants. It's quite possible that this will be a scenario like the flu, where we get a booster every year and of the different variants, and it may never go away completely. We may be able to put it at a dull roar, but you know, it remains to be seen what the long-term future is. But I think in the short term, we'll have to go back to a staged normalcy.
Dr. Parikh?
No, I guess what we all hope for, that yes, we're not going to return to complete normalcy, but even with masking, even with social distancing, if we could go back to some sense of normalcy with some freedom of movement, you know, some freedom to explore, I think that'll be good enough for now.
Dr. Cohn, we'll wrap it up with you.
Yeah, a similar story to what we've heard. Our Children's Hospital, which serves a heavily indigent rural and rural and urban population, we have generally 200 to 250 emergency room visits a day. This flu season, we're down to under 70 visits a day. We have twice as many doctors in the emergency room as we need. Our intensive care units, which are generally overflowed with ventilators stuffed in corners of the hospital just to take care of influenza A, influenza B, and respiratory syncytial virus. We have 0 cases of RSV, over 1,000 last year, 1,000 a month, and 0 cases of influenza, again, well over 1,000 per month. And it actually has a huge negative financial impact on the hospital, which is great. I mean, the world would be crazy if we didn't need doctors. But I think this is it should change how we, deal with cold and flu season. And I think handshaking is probably on its way out. I think masking in the theaters is probably going to be there to stay. I'm not sure I want to sit next to a person coughing if they're not wearing a mask anymore. So I think airplane flights with masks are going to be probably here to stay, just because it makes common sense.
Well, thank you all for your insight on that. And I'd like to remind everybody, if we didn't get to your question, don't worry, you will get an answer offline. And I'd like to thank my colleagues, Kara Strittmatter and Margaret Moore, whom I know many of you know, and they're in the background making sure these webcasts happen. And to our patient families, thank you for your very great questions tonight. And to our panel, I really, on behalf of the patient families, thank you for your time. We really do appreciate the availability you made to answer these questions. And I hope if we have to do it again, it will be under better circumstances. Our next Ask the Mito Doc will come your way March 23rd. We will be talking about medical billing, and we hope you will be able to be with us. Until then, good night, everybody, and stay healthy and be safe.
Good night. Thank you.
Good night.